Welcome back. It's not easy to talk about women's health issues like incontinence, even among friends. But today, a place where you can feel comfortable getting the care you need. Joining us now is Dr. Sumana Koduri from SAAK Women's Health Center for Incontinence and Pelvic Health. It's wonderful to see you.
Thank you, Molly. It's nice to see you too.
Thanks for being here. I've been to the center.
Yes.
It's absolutely beautiful. And one of the things I just wanted to start with is why you decided to open up SAAK Health, because you have several different specialties there.
We do. We have interventional cardiology, cardiovascular care, we have wound care, and we have the Incontinence and Pelvic Health Center.
I feel like what you do is so important, mainly because so many people have issues, but it's a really hard thing to talk about, even with your own doctor or the friends and family who are closest to you.
Yes, unfortunately it is. It's an embarrassing condition, and obviously people feel there's several reasons. They feel like nothing can be done about it. Mm-hmm. There's not much education out there. People are embarrassed, obviously, to talk about it. Doctors are embarrassed to talk about it, or they don't have time. When you go to a primary care physician, there's so many other conditions that they're dealing with that sometimes it just gets a little bit overlooked.
Yeah, I think you're absolutely right about that. Let's talk a little bit about first incontinence, why it happens, what the most common things you see, and why it's important for someone to address it.
So urinary incontinence, and you can also have fecal incontinence, stool incontinence, but I'm talking primarily about urinary incontinence right now. When I say that it can be a marker of something else going on, so it's probably important to look at. Many a time, it's a major quality of life issue.
Yeah.
You know, it can be socially isolating. People don't want to go out. They avoid social activities because of it, and that can lead to things like depression, isolation, and
social anxiety.
Social anxiety.
I get that, because a lot of times we joke about jumping or coughing. You know, it happens with exercise, or when you laugh really hard. But it's something that can be more than just a nuisance. It can get into something where people are isolating and separating themselves, like you said. What types of incontinence are there? Because a lot of women who've had a baby or several babies are probably familiar with it.
Right. So there are several types, and that I think is a very important point to make. I hear so many times that, oh, so-and-so had the surgery, and so I don't want that, so that's why I never came in. Mm-hmm. Well, what I want you to understand is that there's different types of leakage. There's different types of incontinence, and certain treatments only treat certain types of incontinence. So stress incontinence is kind of what you're talking about, the young moms are very familiar with. I can't jump, I can't run, I can't bend, I can't lift up my child without having a small leak or something like that. That would be something that we call stress incontinence.
Okay.
Not anything to do with, you know, a stressful state. It's just It's just called that.
Stress on the bladder.
Stress on the bladder, the push on the bladder,
and it
kind of activity related.
With pregnancy, because there's so much pressure on that area, and if you deliver a baby, all of those things become more lax.
They become more lax and weak, and therefore what I call the urethra, the lid of the bladder, can't be as tight as it should be to hold the urine in. So anything that pushes on the bladder, especially when we're jumping and coughing, urine can come out.
What are the other types of incontinence?
Another major type is urgency incontinence, related to the urge to go to the bathroom. This is the kind of leakage that people talk about. I can't get to the bathroom in time. When I'm putting the key in the door, it's already starting to come out because I get this urge, and then all of a sudden I have to go now. That is urgency incontinence.
Okay. In terms of treatments, do you have a lot of different options because there are different types of incontinence?
For sure. Exercises are very good at actually helping both types of incontinence.
Like Kegel exercises?
What we talk about as Kegel exercises. And what research has shown is that when Kegel exercises are done, like if you read it on a piece of paper, 50% of people do them wrong. So I really recommend seeing a pelvic floor certified physical therapist for it. That can help them kind of get started on it, and then they keep up with the exercises on their own.
Okay.
And then for things like stress incontinence, where we're trying to tighten up that lid, there can be devices called pessaries or surgery, and people are familiar with the word sling.
Okay. And are there some laser treatments that work too?
There are some laser treatments out there that can help kind of strengthen that pelvic floor, kind of like what Dr. Mangione was just talking about. We can also do those types of treatments in the vagina to help the pelvic floor muscles.
Whatever it is, though, I encourage people to see a specialist like you. You have a beautiful office. You have a wonderful new age chair. It's much more comfortable than the old laying on the bed and putting your feet up in metal stirrups. I think what you do is fabulous. Thank you so much for being here.
Thank you, Molly.
Yeah, and parking is easy at her office, and you can get in a week too, which is incredible. Okay, so the Women's Center for Incontinence and Pelvic Health at SAAK Health, they'll talk openly about the issues that so many of us face and impact everyday lives. Here's their number to get an appointment. It's 262-444-5148, or check them out online at SAAKhealth.com, and SAAK is SAAK.